Good afternoon. I would first like to thank Chairman Altino and members of the Assembly Committee, Commerce Committee for hearing the New Jersey Social Impact Bond Act today. This afternoon, we are considering a new and innovative way to access private capital to fund public initiatives to reduce healthcare costs and improve the quality of living for many New Jersey residents. Today, you will hear live testimony and as well as written testimony from experts in the field of social impact bonds, such as George Overholser, the CEO and founder of the Third Sector Capital Partners, Rick Rush, CEO and founder of Collective Health, Tracy Falangen, CEO and co-founder of Social Finance. Their statements outline the benefit of exploring initiatives that open new funding sources and shift how we measure success towards quality of outcomes. I am here to talk about the need for expanding programs that improve healthcare outcomes for our state's residents. Every day in my role as patient relations specialist, I see patients who come in the emergency room with chronic conditions that could be managed with routine preventative care. Unfortunately, they do not have the resources or access to this care and end up in the hospital when their condition becomes critical. Because they also lack the resources to pay for surgeries or other treatment options, they often end up in the hospital again, and again. This is, of course, a terrible cycle, but we can change it. There are nonprofit programs here in New Jersey and across the country that are helping these individuals access care for their conditions, improving their quality of life and reducing the shared cost of healthcare in our state. Yet, these programs have their limitations as well, often hampered by their access to funds. As former Camden City Council President, I am well aware of how few funds the city has to spare on social programs and to protect our most vulnerable residents. The reality is that as we continue to climb out of one of the worst recessions in our lifetime, public revenue for social programs is shrinking across the board. And we need to begin looking at new ways to supplement them. This bill serves as a strong foundation for beginning that process, a foundation on which we will be able to build for years to come. It creates the opportunity for a mutually beneficial public-private partnership that accomplishes a social good without overly burdening the taxpayers. The methods we are exploring can be used to address many social issues facing our residents throughout New Jersey, such as homelessness prevention, reducing recidivism, job creation, or substance abuse programs. Again, I thank you again for considering the New Jersey Social Impact Bond Act this afternoon, Mr. Chairman. Now I would like to turn the floor over to Michael Clerk.